Good morning. Thank you for joining us for this week's weekly Wednesday presentation from Prime Care Coordination. This presentation is being recorded and will be uploaded to the Otsego County Office for the Aging Facebook page and to our county website. I ask that everyone except the presenter and myself keep your videos turned off and that you remain muted unless you have a question. Please feel free to unmute yourself and ask questions as we move through today's presentation. You can also use the chat feature if you prefer, and I will ask those questions for you. For those who are new to Wednesday presentations, we host presentations every Wednesday using the same link at 11 a.m. Topics are on various community-based organizations and topics related to long-term services and supports. This was established in October of 2020 as a way to continue education on services and supports amid a global pandemic. For those who do not know me, my name is Alicia Chase. I'm Otsego County's long-term care coordinator. My role here at Office for the Aging is program manager of the New York Connects program. This program provides information and assistance on all community-based services and long-term services and supports available in our county. Although my office is under Office for the Aging, we are unique in that we are able to help anyone of any age who is looking for help navigating the complicated systems available. We can assist those who want information and assistance, who need referrals to other community-based organizations such as the Department of Social Services, to mental health, Catskill Center for Independence, Disability Services, Family Resource Network, interagency referrals here to our own OFA or other adult services, Social Security, just to name a few. We can help people who need help with applications, who need help seeking information on admission to adult homes or nursing home placement. If you're unsure if New York Connects can help you or a loved one, please do not hesitate to reach out to our office. We also have a New York Connects partner with Vince Baker with the Independent Living Center in Oneonta. Those wishing to reach out to me can do so by calling Office for the Aging at 607-547-4232. I did include my business card in the chat box. If you would like to reach out to Prime Care after this presentation for more information or for a specific situation, please enter your name and email or your phone number in the chat box. At this time, I'll turn the presentation over to Andrea with Prime Care Coordination for today's presentation.
Hi, my name is Andrea Foote. I am the Individual and Family Engagement Coordinator with Prime Care Coordination. So I engage with family members all across the state to help them to become educated on the services that we provide. Along with me today is my co-partner, co-presenter. Her name is Elizabeth Bentley. She goes by Libby. Libby, if you'd like to introduce yourself a little.
Sure. Hi, everyone. My name is Elizabeth, or Libby Bentley, and I'm the Student and Family Education Specialist for Prime Care Coordination. And I will explain what I do for the agency a little bit later in the presentation.
Are you able to see the slideshow?
Yes.
Okay. Okay. So just so everybody knows what our mission and our vision is, our mission is to partner with people with intellectual and developmental disabilities to help support them in their lives in the most meaningful way possible, no matter what that is, whether that's, their home, their work, their family, whatever their passions are. And our vision is for people with intellectual and developmental disabilities to be thriving in the communities of their choice, again, wherever that may be. So some of our shared values that we have here at Prime Care are really that responsiveness, inclusion, innovation, and integrity, as well as independence to the best of someone's ability. And we also say that, getting results by taking the time to care is really our motto, kind of. We are listening to what people need and what they want and trying to get them connected to the best services possible for them to live that life specifically. So this is our coverage area. So we are in 39 counties within the state. We do take a regional approach when it comes to that coverage area or that footprint, because different areas and different communities really have different needs, whether it's, weather related with, 10 feet of snow in Buffalo or a flood in Broome County or whatever that might look like. Our care managers live in the areas that the people that we're supporting live in. So they know those communities, they know those services, they know those providers so that they can connect the people that we support to those service providers in that local area. We do have offices in all of our regions. Most of our care managers, especially right now due to COVID, are working remotely. So, they're working from home, but they're still, connecting with the people that we support either virtually over the phone or, if the need arises and there really is an immediate emergent need, we do meet with people in person, even though we are currently in the pandemic. So you may ask, who is eligible for our program? So eligibility through the New York State Mental Health Hygiene Law states that the person must meet the diagnoses requirements. So I have it listed here. So an intellectual or developmental disability, autism, cerebral palsy, epilepsy, familial dysautonomia, or a neurological impairment. The disability has to have occurred before the age of 22. And the best example I can give with that, and probably the simplest example I can give with that, is if somebody was to have a traumatic brain injury, like let's say they got into a car accident, if it happened before the age of 22, they may be eligible for our program, whereas if it happened after the fact, they may be eligible for a different waiver service, such as traumatic brain injury. This has to be expected to continue indefinitely or permanently. However, there is eligibility, it's called provisional eligibility for children under the age of 8 years of age. So if somebody is seeing some delays, they can look and see if they can get our services and we can help them, and then they would be reevaluated at about between 7 and 8 years old to see if, if they we're able to get back up to the point of what we would consider, typical age-related education needs, or if they needed to continue with the services permanently through adulthood because they have those needs for this specific service. The other thing that you'll see listed here is causes a substantial handicap to a person's ability to function in society. This is specifically listed because there are some people, specifically with autism, who have very, very high IQs, but may have some concerns when it comes to functioning in society with normal day-to-day functions. They may be lacking in that ability to be able to socialize or do things that, in normal society that they might not be able to do. They may be lacking in some of those areas. So for our enrollment department, so this is for eligibility or enrollment. Our enrollment coordinators can be reached at the 1844 number, and it's option 1. So what they do is they collect all the documents that they may need to put the packet that is necessary into OPWDD. So sometimes evaluations are needed. So if evaluations are needed, they can make referrals for those evaluations to wherever they are in their local community to get those evaluations completed. They can help, like I said, apply for that OPWDD eligibility, which is quite a large packet. And one of the things that we want to do is make sure that when that packet is being handed in, that everything that is necessary is in that actual packet, so that it's not being sent back, especially because a lot of times when parents are sending in those packets, a lot of times they're kind of almost in a crisis situation where they're really in need of the services as quickly as possible, and that can take some time to get that eligibility approved. The other thing that our enrollment people can help with is applying for Medicaid. We are a Medicaid funded program, so people need to have and maintain active Medicaid for this program. There are Medicaid waivers available so that a person can receive Medicaid regardless of their income. And one of the examples I use there is what's called a family of one waiver, which our enrollment coordinators can get people applied for, which is basically it goes off of like a child's income, which 9 times out of 10, you know, a child's not getting any income. So that's more easy to be put through that way because a parent may be over that, you know, that cap, that income cap for Medicaid. And we do also have bilingual enrollment coordinators. We have several people that speak quite a few different languages. So Spanish is one of our main languages with people that we help to provide you know, enrollment with. We provide all of those enrollment documents in the language of the person that is being enrolled into our program.
So what is a life plan? The care manager really works with the family and the individual to create a life plan to meet their needs and their goals. Andrea, can you go back? Thanks. Basically, the life plan is a comprehensive guide that's developed through a person-centered planning process directed by the individual and the people that they choose. So that could be their family members, advocates, or service providers. The life plan will address any services and supports that the person needs to live as successfully and independently as possible. And it's really kind of that comprehensive plan that includes support for health, wellness, behavioral health, and family services. What are some of the services available? So at Prime Care, we do not actually provide any sort of services. What we do is we link and refer people to services. So those types of services could be day hab, community hab. Community hab is really great because somebody can come into the home or take the person out into the community and work on different social skills or independent skills, pre-vocational training, supported employment, and self-directed services. Self-directed services is really great because instead of the traditional way where you have a disability and they say, here are the services available, here are the agencies that provide it, they actually use some sort of equation to figure out how much support you need, and they will equate a dollar amount so that you can pick and choose your services. A really great piece to that is that typically you're getting for an agency supported respite or community hab, they're getting close to minimum wage, whereas with self-directed services, depending on how much you have in your budget, you can actually choose how much that person gets paid, and you get to choose who that person is. And so that really helps kind of attract as well as maintain high quality staff. And then respite is just giving relief of care to the caregiver. And housing, there's a lot of different options, not just that group home model that has been in the past. There's a lot of different ways that you can be creative with housing, and then also intensive behavior support. So unique to Prime Care Coordination is my position, which is the Student and Family Education Specialist, and I help assist families with navigating the special education process. Wherever your family member is within their education, from transitioning out of early intervention to graduation and further education, I can certainly help out with that. So I serve as a resource to our care managers as well as our clinical staff and families to help explain IEPs, answer questions, discuss concerns families may have regarding services and their school districts, and explain the special education process, as well as help families advocate at CPSC, CSC, transition, or other school meetings. I help to educate early intervention programs, school districts, and community agencies about Prime Care Coordination, and help with any questions regarding enrollment, eligibility, and what services are available, similar to a presentation like we're putting on for you today. And then I work very closely with the clinical staff. We have one licensed social worker that kind of works with behavioral health, and an RN. We typically have one of each in each of the regions, but I do believe in Western right now we need to fill the position of the social worker. And then we just assist care managers and provide an additional level of perspective and support and expertise. That is my contact information, so you can feel free to contact me with any questions. So we kind of get these frequently asked questions. When can a person or family start utilizing the support of student family education specialists? This service can be utilized immediately upon referral. So as soon as you call that 844 number, I can start working with the family. So that's really helpful for situations where parents may have waited till the last minute and students are getting ready to age out of school. I can start helping them while they're going through that eligibility process. This also works really well for families that may be having some issues at school and they would like me to help them out with advocating at the school while they're working through eligibility, since that is somewhat of a lengthy process. Does this service cost anything to the families? No, it is a complimentary add-on service provided by Prime Care Coordination. We saw that there was a need in helping families navigate their school system, and this is how we are filling that need. Is there a waiting list for this service? No, there is not. You have my contact information. You can feel free to either send that to families that you support that may need that, or you can reach out directly as well. And then I'll pass it on to Andrea.
I do have a question in the chat.
Sure.
It's about eligibility criteria. Can a patient be referred without Medicaid and PCC would assist with the application, question mark?
Yes. So you do not have to have anything when you call the 1-844 number. You can come completely empty-handed, and a enrollment coordinator can help you to collect and get all of the stuff that you need. Like I said, they will sit down with you and go over everything. I really recommend that people do it that way, because it can be a very cumbersome thing to try and do yourself. And again, you know, we don't want people trying to do that and then you know, send in the packet or apply for Medicaid and be missing something, because, you know, then you're delaying every time that something's missing. So, you know, some of the things that people need, you know, assessments and stuff. So like a physical assessment, a psychological assessment, things like that, that are going to be needed for the OPWDD packet, and then information that would be required for Medicaid. You know, they know what they're doing. Those enrollment coordinators know what they're doing, and they really know how to make sure that everything is in the packets that are necessary, so that we're getting, you know, the ball rolling and getting people what they need as fast as we possibly can.
And then additionally, is there a statute of limitation for disability? For example, the patient is now 50 but was disabled at age 20?
So we've actually had that come up quite a few times. So what we say with that is it is very case specific, but if there is documentation for a person, whether that be school stuff, you know, evaluations that the school had, things like that, paperwork that can be collected to prove that the person had a disability, you know, while in school, school-age things, doctors, you know, doctor's notes, things like that. Those are all things that the enrollment coordinator would collect to try to, quote unquote, prove a case that yes, this person did have a disability. I think the oldest person so far that we were able to get was 54. So yes, we can, if there is information and documentation to prove that.
That's all in the chat so far.
Okay, so kind of to what Libby was saying, so we do have several different people on the clinical team. So we have our director of clinical support. So that person is really responsible for designing and developing all clinical coordination supports for Prime Care Coordination. So the clinical team works in conjunction with a care manager. So let's say a clinical support specialist, maybe somebody is having some significant behavioral concerns. This person would work in conjunction with the care manager to really get those behavioral supports in place and or any possible crisis supports in place, so that the person could have the supports necessary to really be able to be as independent and functioning, as possible, so that they're not caught in that behavioral concern. Same with a registered nurse. So we have, people that we support that are relatively medically frail, or may need a registered nurse to really help in regards to certain medical concerns that a person is having. That registered nurse does, again, work in conjunction with that care manager to help get them the best medical supports possible, depending upon what their medical need is. And then our regional clinical teams do complete clinical analysis, case analysis reviews, just to even, look and give a different perspective. If they see a concern, let's say with a certain person, they may, suggest to a care manager, hey, this person may do well with XYZ, to help get them, in an even better place than they already are. So like I said, I am the individual and family engagement coordinator. So one of my my roles that I do is I do what are called the individual and family advisory boards. So Prime Care has an individual and family advisory board in all of its regions. These boards are made up of the individuals, family members, caregivers that are served specifically by Prime Care. So what they do is they really give feedback to us, and they help us with recommendations on policies and procedures, especially the ones that directly affect them and the people that are being supported. And then they also review quality outcomes to provide guidance for our organization in relation to identifying any quality improvements that we can make in our agency. So we want their specific feedback. So that's that is something that all of the different care coordination organizations have, but it is something that is a really important thing to Prime Care, because we always want to be doing better, and we always want to get that feedback from the individuals that we support, as well as their family members, because the individual, their life, we want to make sure that we're looking at everything as comprehensively as possible, and we're giving the best service possible when we're giving that care management service. So what can community agencies do? It's really about collaboration. We want to make sure that we're educating the people out in the community, but that what you can do as an agency specifically is to educate and refer families as early as possible. So like Libby had said earlier, sometimes what happens, in the school and education area is that, kids are starting to age out of school, and it really becomes worrisome because, the school bus stops coming eventually. So we want to make sure that if this child needs a service, that we're making sure that that service is going to be in place when they graduate high school. Or if a person needs services like community rehabilitation to learn how to do banking, grocery shopping, whatever it is that that person specifically needs, whether, because we do work with people from birth to end of life. So it may be children's services, it may be adult services, it may be senior and elderly services. We want to make sure that we're getting people the services that they need, and we're getting them to them as early as possible. Also educate and provide resources for care managers on services that your agency provides, so that we can refer those families to you. So like what I talked about earlier, so one of the other things that I do is I work with providers of services, and I get their information, and we have an internal directory at Prime Care Coordination, and our care managers can refer directly out to those service providers in the community. So if you have a service provider that you think we should get in contact with, Alicia has my information. You can contact me directly, and I will reach out to them to get them in our directory to make sure that we can refer out to them, so that the people that we support can get those services. And then if you guys are having any resource fairs or other events that you're hosting or that you know of that are being brought on in the community, please reach out to us. We would love to be part of it, to make sure that we're reaching as many people as possible to get the services for those people as soon as possible. And then, like we said, that referral line or intake and enrollment line is the 1-844-347-3168, and then you can press option 1, and that will get you to the intake and enrollment line. Any other questions?
Are there any other questions out there? You can go ahead and unmute yourself and ask them, or you can type them into the chat.
No problem, Pam. Well, if you guys do have any other questions, like I said, Alicia does have my email information as well as my phone number, so please feel free to reach out. I would love to answer any questions that anybody might have regarding the services that we provide.
All right, I always am hesitant to like say, that's the end, because I'm afraid someone's typing. All right, well, here we go. So that will conclude our presentation for today. And again, if you have any questions, don't hesitate to reach out to me here at Office for the Aging, and I can get you connected to Andrea or to Libby. All right, thank you for joining us today.
Thank you.